Guys, looks like we have a lot to cover about UTI. I did not realize that. Okay, now, recurrent UTI each time is worse, like having flank pains. Okay, now you gotta understand urinary tract infection. Generally, you will feel, we call it burning, okay, dysuria. You will feel frequency, okay, that means you constantly feel like you need to go to the washroom, okay. And then you will have, we call it dribbling ataupun like leaking like a tap. So dribbling means that you're just standing and it's just dripping, okay, and you finish urinating and it's still dripping. All this kind of pain usually comes with suprapubic pain. Suprapubic pain means like kita kata sakit ari-ari, or your lower abdomen pain, so it's like a cramping kind of feeling, something like you feel like diarrhea is going to come. But if you get it together with flank, this is flank for those who don't know, okay, so the sides here, your kidney is here, okay. So if you get it usually with flank pain, we need to rule out kidney stones, okay. So when you have kidney stones, quite common among men, not really in women, but of course there are people with it, okay. So now when you have kidney stones, okay, you will have flank pain with urinary tract infection. There are days where you can suddenly get just flank pain alone, but generally this occurs together. And the flank pains are really bad. You can't stand straight. Most of the time you can't even, you feel like you cannot breathe. 98% of the cases that comes to the clinic, I will say that they definitely need injection to get better. Okay, you remember cannot stand. Some of them even come in wheelchair or someone carrying them. It is that painful, okay. So we need to either go for an x-ray or go for ultrasound. So you see, x-rays, sometimes even the smaller ones can be seen. Ultrasound, it really depends. Some stones, how it can be seen, okay. Another thing is that there are stones in the bladder as well. A lot of people don't know that, okay. There are stones in the bladder, which is not very common, but yeah, that is possible, okay. So other than that, usually if it's other kidney infections, okay, your urine will be a bit different lah, okay, like discoloration, okay, if you have or smelly frothy urine, because there is pus in the kidney cases juga, which will come with flank pains, okay. So the best, this is what I can advise. So you can get an ultrasound, you can get a blood test, you can get an ultrasound, you can get an x-ray done to see whether the flank pains are coming because of just the UTI or because it is coming because of the stones, and then the UTI is caused by that. Okay, alright. But if you don't have stones and you always get flank pains, then it's most probably dehydration could be the cause as well. Okay, alright. So next question, guys, let's explore this deeply.